Hello, my name is Abby O'Keeney. Today I'll be demonstrating the 9 vital signs on Mr. B. The 9 vital signs are his overall appearance, his mucous membranes, his capillary refills, his pulse, skin pliability test, his heart rate, his respiration, his gut sounds, and his temperature. We would check these vital signs to get information about the horse to better communicate with our vet and better know what condition our horse is in. The first thing we'll be going over is their overall appearance. Mr. B is out of his stall, so he's acting a little bit more anxious than he usually would, but you need to get to know your horses and know how they normally act. Do they stand at the front of the stall? Do they stand at the back of the stall? Have they passed feces today? Have they eaten today? Have they drank water? You check all the things like this to make sure that they are doing their normal things and making sure that they're healthy. Are they sweating abnormally and they didn't just exercise? Those are things that you should take note of and be aware of so you can better understand your horse. When you look at Mr. B's overall appearance, you can see that he has no cuts and scrapes. His coat is really shiny and healthy, and he doesn't look distressed overall. He's not sweating. You can't tell, but he's obviously breathing heavy. He looks overall very healthy and happy. His ears are forward, his eyes are bright. From head to tail, he is a healthy horse. The next thing we'll be going over is his mucous membranes. A healthy horse should have pink, moist mucous membranes. If they are not moist, he could be dehydrated. If they are anything besides pink, such as yellow, that could mean jaundice, which is liver problems, or brick red, which could be infection, or blue to purple, which can be a lack of oxygen, or very pale, which is anemia. To check the mucous membranes, we will lift the lip, check the color. His is pink and moist, which is good. And then to do the capillary refill, we will press our thumb into his gums and then release. The color should return within 1 to 2 seconds. He is a healthy guy. Another place you can check the mucous membranes is in the conjunctiva of his eye. You simply pull back his eyelid a little bit so you can see the color right there, and it should be pale pink and moist just like his gums are, and they are, so he's a healthy guy. While I'm checking his mucous membranes, I will also check his capillary refill time. I will lift his gums, press my thumb against his gums for 1 to 2 seconds, and then release. His gums will be blanched, and then the color should return within a second. If it takes longer than that, that could indicate dehydration. Okay, the next thing we'll be going over is the pulse. The pulse is most easily found in their maxillary artery. That's located underneath your cheekbone. Whenever you go to find it, it will feel like a noodle. And when you find it, what you do is you set a timer for 15 seconds and you count. Out loud typically helps to keep your rhythm. You count, and whenever 15 seconds is up, you multiply whatever number you got by 4 to get your beats per minute. Your horse, if it is at a resting state, should have a BPM of 32 to 44 beats per minute. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I got 10, and 10 times 4 is 40, which falls within the 32 to 44 beats per minute range, which is good. That means he's healthy. Another way to take their pulse is with their radial pulse, which is behind their knee. It's a little bit harder to find, but a lot of people can actually find it back here. You do it the same way as you do the maxillary artery, and you time it for 15 seconds, you count out loud, multiply that by 4. And then another place that you can find the pulse if your horse is having hoof issues is their digital pulse, which will be down here on their pastern. And you do not want to find this. If your horse has a digital pulse, it is an indication of some issue with their foot, whether it's laminitis or a hot nail or an abscess. The next one we'll be going over is the skin pliability test, which to do this, you will find the triangle where you would also give IM shots, which is in front of their shoulder blade, below the ligaments and tendons that run along their neck, above their spine in this triangle. What you do is you just grab a little piece of skin, you pull it up, and you release, and it should go back down in 1 to 2 seconds. If it tense, which is where it stays up, that means that they are either dehydrated or an older horse. Older horses' skin elasticity breaks down over time as they age, and so it will not go down as fast. The next thing we'll be going over is his heart rate, which can be found with a stethoscope on his heart girth underneath his elbow. His heart rate should mirror his pulse in that it should be between 32 and 44 beats per minute. And if it does not, can be because you were counting on the upbeat or the downbeat and doing the opposite with the pulse. To do the heart rate, you will need a stethoscope, which I have. Most stethoscopes, you will need to put them in this way. This particular set of stethoscopes is odd, and I have to put them in backwards for them to work. So you take your stethoscope and put it on the heart girth, travel underneath their elbow, and find their heart rate, which will sound like a ba-dum noise. One, two, three, 4, 5, 6, 7, 8. So I got 8, and I timed it for 15 seconds. So 8 times 4 is 32, which is lower than his pulse, but still within the range. And also, again, it could be because I was counting on either the upbeat and the downbeat for his heart rate and counting for the opposite on his pulse. The next thing we'll be going over is gut sounds. Normal gut sounds are a low rumbling, and it's pretty consistent. If you don't hear any sort of sounds for 2 minutes, that could be an indication of impaction colic. And if you hear rushing water, it's called hypermotility. And it's usually accompanied by lots of runny poop, feces. And usually it just means they have like an upset stomach and they've eaten something that isn't agreeing with them. And if you hear pinging, that is an indication of gas distension. To actually check for gut sounds, you can either press your ear against their sides or use a stethoscope. Whenever you do this, you will check in 4 quadrants. They're the upper and lower on his left side and the upper and lower on the opposite side. So I'll check these. I hear rumbling, which is good. I'll check the lower one, which I also hear rumbling. We walk around the horse, letting the horse know we are there. We'll check the upper quadrant on this side, which I hear rumbling. And I hear more rumbling. Now, keep in mind that whenever you're checking these, if your horse is actually colicking, he could be in a lot of pain and discomfort and may not want you to touch his stomach. So do this if you can, but remember to be safe. So the next thing we'll be going over is the respiration, which can be checked by standing at their shoulder and watching their flag go out and then in, which is one whole breath. And the range for their breaths should be 8 to 16 breaths per minute. I like to time for 30 seconds whenever I do mine. So I'm going to count my breaths that I see out loud and use a timer to time it. 1, 2, 3, 4, 5, 6, 7, which if you multiply that times 2, since I took it by 30, would be 14 breaths per minute, which is in the normal range. The next thing and the final thing that we will be going over is the temperature, which you will need a thermometer, some Vaseline, and I prefer to use Novosan with some little Telfa pads in it to disinfect your thermometer in between uses. You disinfect it before use and after use, just to ensure that no fecal matter gets transferred from one horse to another. So I will remove my thermometer from its case and set it aside, and then open up my Novosan and remove a 4x4 pad and wipe off the tip, which make sure it's nice and clean. Throw that to the side, we'll throw that away later. Close this for now so no debris gets into it. And then I will take the Vaseline and open it up. And you never put the thermometer into the Vaseline. You always swipe some off with your finger and apply it to the end. And you do so very generously. And then after you've done that, close your Vaseline. And you can turn on your thermometer. Whenever you turn it on, it should read low because it is too low of a temperature to pick up on. Whenever you go to actually apply the thermometer, you need to push your tail away from you so you have plenty of room to work. And then carefully and gently insert the thermometer into their rectum and then push it to one side or the other so it's against their rectal wall and not inside of any fecal matter. Okay, and obviously I waited for it to beep, and then I took it out. His temperature is 99.1, which is slightly below the normal range of 99.5 to 101.5, but that is okay because this is a digital thermometer, which runs lower than, per se, a mercury thermometer. Now we will clean off this thermometer, turn it off first, that helps, and then open up your Novosan, remove a Telfa pad, and then remove any feces and Vaseline that you have on the thermometer, then throw the excess aside, put the thermometer back in its case, and you are finished. The other kind of thermometer you can use to take a temperature is a mercury thermometer, which reads more accurate than a digital thermometer, but is a little bit more time consuming to use because you have to make sure that there's a string attached to it, so you can either hold on to the string or tie it to their tail while you're waiting for 2 minutes to pass. And to prepare the mercury thermometer, first you'll clean it just like you would a normal thermometer. Then you will shake it down to where it is below 97 degrees Fahrenheit. Then you will apply Vaseline to it. insert it into the rectum, and either hold onto the string or tie it to the tail and wait for 2 minutes. And then after the 2 minutes, you remove the thermometer and you read it, and then you clean it off with the Noble sand.